Welcome to HealthCast. I'm your host, Adam Patterson. Today we're joined by Kevin Patel and Allison Amrhein of the Veterans Affairs Innovation Ecosystem. Kevin is the VHA Innovation Ecosystem and Challenge America COVID-19 Maker Challenge Series winner. He recently presented at the 2020 VHA Innovation Experience Forum, where he debuted a telehealth case prototype that has shown considerable promise for expanding the horizons of VA telehealth. Allison is the Director of Operations for the VHA Innovators Network. Allison works to bring together the efforts of product developers so they can apply their innovations towards improving the delivery of healthcare to America's veterans. Allison and Kevin, welcome to the program.
Hey, Adam. Nice to meet you.
Hi, Adam. Thank you so much for having us.
Yeah, great to have you. So I wanted to start the interview with an overview question for Kevin. And Kevin, it sounds like you've been working recently on healthcare innovation and in-home health, especially. You just gave a presentation at the VHA Innovation Experience Forum a couple months ago, back in October. Can you tell our listeners how this work, specifically the telehealth case prototype you're working on, came about?
Sure, Adam. So the whole world shut down, basically, and I was just looking to help. So we started making PPE 6 times a day in 4-hour shifts, 24/7, and donating some of it to the North Texas VA ER ICU COVID unit. One of the COVID nurses invited me to the COVID-19 Maker Challenge sponsored by VHA Innovation Ecosystem and Challenge America. So we formed this diverse team together called HermTech, which stems from Hermes for innovation and TAC for speed. Having this diverse team helped tremendously because we didn't really know exactly what our challenge or solution was going to be ahead of time that we were going to get assigned. The team basically consists of creative makers, engineers, artists, healthcare professionals, VA employees, just all sorts of people. During these challenges, we really studied veterans and frontline healthcare workers, the battles they have to triage, diagnose, or get to the hospital in this new COVID world and the struggles that they face every day, and just try to connect with that. We ended up creating a rural telehealth case with industrial cellular equipment that can get a signal out to them where they normally wouldn't have any broadband or access to telehealth. We also paired it with diagnostic devices so they could take their own basic vitals. They don't have to come jam up the ER or risk contracting diseases by coming in, and also face those challenges in transportation just to take their temperature or something.
Yeah, I can imagine it really gets around some of the potential risks of in-person transmission and both helps directly address the health needs of veterans while also protecting them past a certain point as well in the middle of the pandemic. And that kind of leads me to my next question, because clearly veterans care has been a very driving and central focus of your work. So what is it like working with your team, knowing these innovations will directly benefit veterans, and it's not just something abstract?
It's pretty clear. It just felt very patriotic and fulfilling. Everyone was super proud of themselves. It took a while for the magnitude of what just happened to sink in, because it's a lot bigger than we realized at the beginning going into it. And it went so fast, there wasn't really time to process it as it was happening. I felt honored and lucky to have a chance to benefit veterans' lives. Most people have this existential thoughts going through their head, and that just kind of all melted away. It was like, oh, we have a purpose and we can help make a difference, helping veterans and people and just the nation in general.
Yeah, I can only imagine. It's because the potential for impacting such a broad swath of lives, considering the VA network, is pretty substantial. So as kind of a broader view, beyond this, what else are you and your team working on right now? Anything else in response to the pandemic and covering veterans care in particular?
Yeah, we have this really cool UVC sanitation equipment. It's kind of like a giant light oven. It makes rapid disinfection times of large items just a few seconds instead of, say, like 5 minutes. You can also combine the panels together to make it ever larger. So you could get into the ER setting and start getting those frequently used items like IV stands, pumps, wheelchairs. We're currently trialing them with Allison over in her Asheville and Tampa sites with the VR program headsets. We also have a mass manufacturable ventilator where it revolves around eliminating the hard to source parts in the supply chain, especially the electronic flow sensors. You can really build these things out of anything like aluminum, plastic, or cardboard, and use whichever tools around, 3D print them, mill them, or laser them, and stockpile them since they're like 50 to 100 times cheaper than some of the normal ventilators. Last, we have medical microfactory shipping container, including a digital product library and raw material processing. We're building it over at the University of Texas at Dallas in the Research Office Center parking lot with the Venture Development Center. We have a plan, and we'll see how much we can do kind of as an extension to the 3D print library.
Yeah, no, that's fascinating. And I'd imagine especially that the VHA's supply chain has been under pretty high stress amidst the pandemic. And I can only guess that this will help really smooth out that processing and help expedite the delivery and comprehensiveness of care.
Yeah, that sure is the plan. Anything we can do to help. We know the supply chain's broke, and however we can eliminate them so people can on-demand manufacture the equipment and PPE they need on site is what we're after.
Absolutely. So the next question I want to ask is for Allison, which is, how did the collaboration with Kevin and his team and this prototype come about?
Hi, Adam. Thank you. It has been an absolute pleasure working with Kevin and his team the last 6 months. You can tell Kevin is super passionate about what he's doing, and he's extremely ambitious. So I am the director of operations for the VHA, the Veterans Health Administration Innovators Network, which organizationally within our giant system lives within the VHA innovation ecosystem. And as Kevin mentioned, the ecosystem co-sponsored these Makeathon events with Challenge America all summer. I volunteered to participate in a number of them as a judge, a mentor, and that is where I met Kevin and his team, and how I forged many of the Innovators Network collaborations with Maker Challenge teams.
Yeah, that's really cool to see, because my understanding is that IEX has really helped bring together a lot of more innovation-minded technicians and inventors across the VHA network in different parts of the country who might not have necessarily met each other beforehand. And it really helps foster collaboration in newfound ways.
We absolutely strive for that, believing that innovation cannot be done in a silo or separately, and we are much better equipped to deliver more together.
Definitely. And that brings me to my next question for you, which is, it looks like Kevin's prototype is being developed as part of the, if I'm getting this right, the VHA Innovators Network, the INET, Spark Seed Spread Innovation Investment Program. Can you tell me a little bit more about INET and this innovation program?
Absolutely. This solution, the telehealth case that Kevin was talking about, I'm just going to call it the case to make it easier, found its way into our space, the Innovators Network space, through a VA employee. Kevin mentioned that each challenge starts with an end user submitting a problem that needs to be solved. The end user in the case of the case was an employee at the Pittsburgh VA Medical Center. And Pittsburgh is one of 40 sites that make up the VHA Innovators Network. So the Innovators Network, we call it INET, is a group of VA Medical Center leadership and employees that have committed to building a culture of innovation at their facilities through empowering frontline employees to design solutions to the problems they face every day. What we do is host an annual crowdsourced competition. Spark Seed Spread is its short term. Spark Seed Spread Innovation Investment Program is its long form name. To identify, so what it does is identify employees and their ideas to innovatively solve a problem. We then provide the resources to not only support the employee to design and test a prototype of their solution, but we also lead them through a year of kind of accelerated innovation learning about the theories and fundamentals of innovation that will help them grow and will boost the likelihood of them designing and implementing an impactful solution. Spark Seed Spread refers to the maturity of the solution. So in this case, the case that Kevin is talking about is a seed investment, which means it has been prototyped and will use its investment year, which is 1 fiscal year, to continue to tinker with their prototype through lessons learned from end user experience testing. The idea behind iNet really is to design solutions to solve problems, not just for the sake of innovating. That means that not all of our investments are successful, quote unquote successful. Some fail, some pivot, and that's okay. We encourage employees and their partners like Kevin to go for it, to start small, fail small. And I cannot begin to tell you what a rewarding experience seeing these employees grow throughout the year and to see their solutions go from an idea, from a sketch on paper to an impactful solution that is changing veteran lives.
Absolutely. And that makes me wonder, in terms of other really promising projects that are on the horizon, what other innovations are VA employees involved with iNet working on right now?
Since iNet's inception in 2015, so we're pretty new, we have supported over 600 employee innovators as they're trying to solve their biggest challenges. We just selected our latest class of employee innovators, which is where Kevin and the case come in, and they have some really great ideas. We have a number of employees who are designing new products side by side with their veteran users. One is called Drop Ease. It's the brainchild of a nurse at the Cincinnati VA. Terry Olinger is her name. She designed an eyedropper prototype in partnership with a group called Quality of Life Plus and engineering students with the University of Cincinnati and with veterans. And it's for veterans with dexterity issues. So these veterans have a problem administering eye drops themselves. They either can't squeeze it or they squeeze too much and it doesn't appropriately dispense the drops needed. The device that she has designed can be used by anyone. So this device administers one drop at a time and is easily used. And after being really, truly co-designed with veterans, Terry is back in our investment program this year to test it, to see how it works, to see how well it works with its user population. And it's a really, really exciting one. We also have 2 visually impaired employees who are using their investment year to design new products to help visually impaired veterans. One incredible employee from the Palo Alto VA is designing a new smart cane for the blind. And another employee innovator from Lebanon is designing an alternate alert for the usual caution signs you see on the floor at the hospital, which of course visually impaired veterans may not see, and that can be really hazardous. So she's finding another way to alert some of these hazards. We also have programs that are designed for veterans and employees through iNet. One of our alumni programs is called Pride. And Pride is a 10-week health education program focusing on reducing the health disparities that LGBTQ veterans experience. The program includes literacy training for employees as well, so they can better understand and engage with LGBTQ veterans that they serve. And the training really, really provides not only the specific types of care that these veterans need, but the tools to work with LGBTQ veterans who might struggle with issues of acceptance and identity and belonging. So it really runs the gamut. But in general, we focus on designing solutions for the humans that will use them.
Yeah, that all sounds really promising. I especially like that focus on making sure that there's a practical emphasis, that you understand this is going to go to human care first and foremost, and using that as a very specific driver of innovation. One question I kind of want to wrap things up with, and this is as much for our listeners' knowledge as well, which is, are there any other ways for external collaborators to engage in VA innovation, like, for example, Kevin and his team has?
Absolutely. So Innovators Network in particular has traditionally been focused internally on employee innovation, but we recently, within literally the last few weeks, launched a new initiative to bring in the external innovation community to play a little bit in our sandbox. And this is called the Greenhouse Initiative. And Kevin's team is also involved. The UVC Lightbox he mentioned is involved in our greenhouse. And this initiative allows external innovators to conduct end user discovery and ideation, share early stage product designs for feedback, or even conduct small scale feasibility testing with the appropriate end users within the VA. The VA's stakeholders, our veterans, represent the population at large really well, and they are engaged, and our employees are extremely passionate about really designing these solutions and solving these problems for the healthcare community at large and for the country. So these products and things that we work with greenhouse companies are all run by iNet, and it's really something that is the first ever opportunity of its kind for the external innovation community, and we're really excited.
Yeah, that sounds phenomenal and really promising too, going forward, considering just the sheer amount of talent there very obviously is in the VHA network. Well, I just want to say this was phenomenal. Kevin, Allison, thank you for coming on the program.
Thank you for having me, Adam. I appreciate it.
Thank you so much. Lovely to be able to do this with Kevin.
Healthcast is a production of Government CIO Media and Research. For more podcasts, head to governmentcio.media.com/podcasts. If you liked what you heard, let us know by leaving a review in iTunes or wherever you listen to podcasts. Healthcast is produced by Amy Kluber, hosted by Melissa Harris, Adam Patterson, and Faith Bryan. If you're interested in sponsoring a podcast, contact us at sponsor@governmentcio.com.